All right, Tom, let me kick it off.
Go for it, Steve.
All right, folks. Well, welcome to our December edition to our Fireside Chat series. Just as literally minutes ago, Lake Minnetonka is now freezing up entirely. So, I mean, there's a few remaining sort of unlucky ducks left in the middle, and eagles are trying to get their last snack in. It's nature, sorry. But we're thrilled today to talk about innovations coming in the future in the healthcare delivery system, as well as all the tensions and challenges in the healthcare delivery space as well. And to do that, we have two great guest speakers, both with great Carlson ties, Brett Pederson and Jodi Capistrant, former students of mine, and just thrilled to see you folks engaged in this type of activity. And they're also from Chartis. They've both of them have great careers, and it seems like all the really cool people that are doing transformative work end up at Chartis. So that's my advertisement for all the great stuff you folks do, and appreciate very much your thoughts. So just to give people a sense of the lay of the land and how we're going to be proceeding with this, we have a 30-minute on-the-record session that's being recorded that'll later be posted in about a week or so, and then 30 minutes that are off the record. And this is being sponsored by our Medical Industry Leadership Institute, and not recorded. This is the Medical Industry Leadership Institute, as well as our Medical Evaluation Laboratory and our Medical Industry MBA program that are located overseas. So I hope some folks actually tune in from over there. And actually some of this content sometimes gets used for their classes as well, at least beyond the record part. So thrilled to engage. For those that are, the way we do the decorum on this is that we're gonna have a conversation. Tom and I, Tom Gunderson, former from Piper Sandler, will be going just conversationally here with Jodi and Brett. We're then gonna open it for questions when we get to our off the record part. To do that, just put your cameras on or raise your hands, and we'll call on you to know where things are. Otherwise, we'll just get started with where things tend to be. And for that, I'm going to hand it over to my fabulous co-host, Thomas Gunderson. I'm watching too much Matrix, Tom. I'm sorry, Mr. Anderson.
Thanks, Bob. So Steve pretty much said it all, and I don't think anybody dialed in to hear us talk in intro. So let's just get right into it. Brett and Jodi, you sent us some information earlier that listed out some trends that you're seeing in healthcare delivery. Can you run through those real quick for us?
Yeah, so maybe I can start and ask Jodi to jump in, but sort of as we think about the major trends that are shaping how healthcare is organized and delivered in the country today, sort of 5 big trends that stand out, and I'll give you the quick flyby on that, and then we'll get to the Q&A session. The first trend is that how healthcare is consumed is changing, and that underscores the importance of convenience, access, and cost for healthcare deliverers. So when, where, and how individuals and their families are accessing care is changing, and that's being driven by the availability of substitutes in the market, offering more convenient and more tailored care experiences. Think One Medical and Amazon, think CVS and Walmart, even bridging into sort of the Oak Street types of models. The second big trend is that the healthcare workforce crisis is not a temporary crisis, and new models of care will be required to meet the future needs of the healthcare delivery system. So psychosocial strain faced by different providers, together with supply and demand imbalances, and to some degree, fundamentally misshapen caregiver workforce, are driving low satisfaction across that workforce and unsustainable financials for the health system that necessitate creative solutions. In particular, you think about some of the local challenges going on with the nurses' strike and the very real possibility, at least as of 24 hours ago, that contract labor would have to come in, and that contract labor is very expensive. And what are the implications of that for the health system? Significant, no doubt, from a financial perspective. The third trend is around the infusion of investor-backed capital in healthcare. It's reshaping the industry. Investor-backed capital affords organizations the opportunity to fail fast. And the result is that it's driving innovation and driving scale to a degree that perhaps we've never before seen in the delivery landscape. Privately capitalized companies can be both looked at as a threat if you're a healthcare deliverer today, as well as an opportunity. The fourth trend, demographic and legislative changes continue to place pressure on providers to deliver care in new ways. Many communities across America are aging rapidly. That amplifies the need for value-oriented care and total cost of care management, irrespective of the payment models in place. One of the interesting things that I recently sort of learned was that last year was the first year that we saw enrollment for traditional Medicare sort of level off. And the reason for that is from the huge growth in MA driven by a handful of markets across the country and a handful of, going back to the third trend of private capital getting into the market, organizations like CareMax, buying up physician practices and really going after MA in states like Florida. And the fifth trend, and certainly not the least important, societal health needs are moving from the periphery to the spotlight, creating an unfunded mandate for healthcare deliverers and health systems. The interrelated health crises in our country right now, think the pandemic, racial inequities, gun violence, substance use, and many more, have accentuated the role of health systems and the role that they're asked to play in our communities to meet what at least today are unfunded mandates to impact societal health. And the result of this is that you're starting to see some cross-sector collaboration to improve health and access to healthcare in these communities. So that's kind of our 5 trends. I won't, spend a bunch of time talking at you. Want to, make sure that we address your questions. Jodi, anything to add to that quick summary?
Yeah, I'll just add on to that just a little bit. Just, as Brett was talking about the trends and really these foundational truths, how we are seeing the industry move, where we're really seeing the effect is around, these new sort of healthcare ecosystems that are emerging. And when we talk about the ecosystem, we're really talking about a couple of different characterizations here. One is with regards to, this idea of the traditional one size fits most, so we're going to actually be able to do everything, right? We're going to be soup to nuts. We're going to, horizontally or vertically integrate, right? We see more organizations actually thinking through how they focus their business model in terms of segmentation. So they're looking at, what are the care settings we're going to specialize in? What are the patient populations we really want to be attractive to? How do we want to organize our provider teams, our services to actually meet that specific need? And then they're, like I said, they're focusing their business model to actually enable that role. And then there is sort of the subsequent work from there that is allowing them to use that as their foundation and then expand from that point forward. And so, these new realities, we're seeing some of our traditional provider clients, really react in different ways. And I'd love to have more of a discussion about this is, we're seeing much more focus on financial and economic health driven by, core operations. Some of the things that were the sacred cows are not anymore. And everything is on the table. Much more focus on recruitment and retention, to Brett's point earlier about the workforce, much more development of the provider enterprise, recognizing that there's a lot of latent capacity, latent financial benefit there. Non-traditional partnerships, is I think Brett was alluding to, some of them directly addressing social determinants of health, partnerships with communities, We're seeing, little pockets of what organizations couldn't figure out before, which was like PE-backed provider groups that are now partnering with more traditional healthcare, where they really couldn't find aligned incentives before. They're starting to say, we have to. Monetization of assets. I think we're seeing more organizations look at that. Looking to achieve the value of partnerships, at a much more rapid pace. Or like I said, that used to be a sacred cow. Maybe they were aggregating provider groups, and now they're saying, okay, we actually have to do something with this, or they're not making a decision to, put money there if they're not going to actually do something with that that's going to achieve value immediately. We're seeing care model refinements in, some areas. I was mentioning to some folks earlier that, we've been having discussions with Houston Methodist that's been really talking about this cool model where their admission, discharge, transfer nursing is going virtual within the hospital. So they're using an iPad, they're using a mounted camera, and they've got nurses in a hub who are actually doing the ADT work. And it has cut the time down, from almost, 35, 40 minutes of a nurse's time to almost 10 minutes. It's right around 11 minutes. And they're expanding this. And now nurses are going around to other, units and saying, oh, okay, well, where's your hub nurse? And if they don't have it, it's a dissatisfier. And of course, technology augmentation, right? That's a perfect example of technology, helping out the workflow and the efficiency and such. So, where folks before it said those cameras are too expensive, now we're hearing more clients, and we're actually pushing our clients to say, you've got to invest in the future. So, like I said, that's really where we see some changes happening as a result of some of those, like Brett was saying, those truths. So.
Steve?
I mean, I could just start off. Yes, just start off with just saying, wow. But first of all, just to scale what you're talking about, but also, I mean, a lot of what we think about when we talk about an evaluation lab is focused on innovation, technology, and things like that. You folks are describing the delivery system, mind things, but obviously I haven't heard for a long time, if ever, actually. And maybe it's exciting to me. And I'll tell you if I'm wrong, but I mean, it sounds as though folks are making hard decisions in a way with more expediency than they've ever had to deal with before. That there is money in the system, but at the same time, they're innovating and taking new chances because kind of financially they have to. Am I off?
No, I would agree entirely with that, and I think that infusion of investor-backed capital is a big part of what's driving that, right? If we don't figure it out, Amazon will, right? They have a pretty good track record. Some of these companies that are getting into healthcare, the entire profit of most health systems would hardly even register on their balance sheet. So they're able to do things that that just go so far and beyond what healthcare organizations have been able to do for so long. I think their movement into the industry has, engendered a level of commitment to the transformation that healthcare has badly needed for a long time. Now, we're taking the very first baby steps, right? There's a long way to go, but I think there's a commitment in the hospital and health system, healthcare delivery landscape overall, to some of the changes that need to happen that arguably we haven't seen in quite some time.
So just a follow-up question of that, Brett and Jodi. So I remember, I don't know how many years ago now, maybe was it 5 years ago, 6 years ago, the Berkshire Hathaway, Amazon, JP Morgan, let's all get together, let's revolutionize things. And as near as I could tell, that troika has broken apart, but it sounds as though, as opposed to normal situations where it's like, it's an okay thing, we'll split apart. It sounds like a lot got learned though in the process from the different partners that spilled over, particularly in the private equity space potentially. Is that correct? I mean, and we see Amazon re-engaging in the space again. I mean, the one thing I know, I know folks involved in that. Some of the, actually some folks you folks probably know too, former professor at the U. You remember, if you folks were around when I was teaching medtech evaluation with Bob Town. You know, Bob's a professor, but Bob's very much involved with, you know, Amazon Health kind of cherry picking, you know, success stories or not, to your point.
Right. When you've got a, you know, when you have an industry that's 20% of the GDP and half of it is spent on physicians, clinics, and acute care, you don't want to, you can't ignore it, right? So the you know, VC, PE dollars are not going to ignore that kind of funding. And so they're willing to speculate. They're willing to, you know, try new things there. You know, I will say that it is sort of interesting to hear and have conversations with clients about what they are betting on, right? They're thinking that, you know, particularly provider groups that have been bought and sold, right? When their younger partners haven't wanted to buy in, they get sold to PE, and then they try to make their money. They're thinking, you know, who's going to be the last fool in this chain? You know, that being said, we haven't exactly found that yet. So,
while that partnership, Steve, that you mentioned, the Berkshire partnership went away, the concept didn't. You know, I think Amazon's going to do it by themselves.
Right.
Yeah. Well, they certainly have the different channels, right?
Go ahead,
And they're just experimenting. You know, they're saying it's enough. There's enough potential. You know, there's a big enough potential pot of gold at the end of that rainbow that they're willing to try a number of different ways to go after it. You know, and maybe that wasn't the right partnership, obviously, but they learned a lot, believe me, and they're gonna keep going at it, right? Yeah. So
one last follow-up, and I'll turn over to Tom. So, I mean, you think about those three different organizations. So it's obviously Berkshire Hathaway. You know, it's private equity. There's money. There's all the things, investment banking things they're going to do. That's obvious in that space. JP Morgan, sort of the same thing, a little more boutique-y. So we're actually, the Palo Alto Val trip is coming up, and we might actually engage with JP Morgan, a specialist there. I used to work with Ways and Means in the Hill. But Amazon, we know they have the money, they know they have the capital, but at the same time, they have a massive workforce. To what exchange? I mean, it used to be the case that, like, when employers got involved that were big, like a Boeing or a General Motors, like particularly like the General Motors Detroit story in hospitals, like that was always, like, in a sense, Detroit was always the capital of hospital management, or Chicago, because of just the economic power that's there from the employer side. I mean, is that also happening with Amazon? Because most of what we hear about Amazon is like, here's some interesting ideas, a startup, we're investing, we're changing things. But have they ever really gotten to the point of saying, like, we dominate the entire countryside of the US with a massive workforce and all the distributional channels. They own more planes than anybody else on the planet, or at least they lease more planes. I mean, is that part coming into play too, or is it more just on the health side as a silo?
Well, when you can drive, sorry,
if you know.
Yeah, when you have that type of an employee base, you can drive it. I know that was part of their strategy, right? Initially, it was sort of like, okay, if we can do this for our employees, you know, just think what we could do for others. And that's what we see also with, you know, big Fortune 500 companies, right? Walmart is actually direct partnering with providers and saying, hey, you know what, you're going to be our MSK partner of choice. And, you know, we'll actually pay for you to, you know, go to, you know, Accenture or, you know, wherever it might be to get your care, because we're actually, you know, direct contracting with providers. So, you know, that kind of innovation, it's certainly happening from an employer base. Yeah.
So let me try a different approach or different discussion point, and that is on, I'm going to piggyback a little bit on the chat line question from Peter on consolidation. So you guys are really good, and you're here because you're looking at emerging trends or trends and where they're going from here into the future, and your clients really appreciate that. I'm looking backwards. Trend analysis is always easier historically. But there used to be dozens of pharmaceutical companies. They've consolidated, and now they even put it in their name and call it big pharma, right? So there's a handful. Same thing with the insurance companies. There used to be a lot of insurance companies. There still are, but the business is dominated by 5 or 6 of the big payers. Hospitals only recently, relatively recently, got into this and are starting to consolidate, but there's still, what, 5,000 hospitals out there, or maybe it's down to 4,900 or something now. So the consolidation is a little slower. The one thing I saw with the biggies, especially on the East Coast, that when they started to consolidate is they went from having, hey, this guy's a smart physician and he's done being a doctor, let's make him the CEO of the hospital. Okay. But once they started consolidating, they were bringing in the big shot MBAs and running it like a business, and started to look more at the bottom line and started to do some of the things that both helped and hurt them. All of that's in the past. I get that. What do you see from a consolidation standpoint going forward, and what would be the advantages and disadvantages from the provider standpoint?
Well, let me comment first. Maybe Brett, you can talk about some of this, certainly as I could, but one of the things in terms of healthcare moving slower, obviously that's just sort of the nature of the beast in some of this. You can tell in many of the different workflows and processes that exist even today that, other institutions, financial institutions, airlines, et cetera, are far beyond. But they also have, right now, very clear barriers, right? You've got the FTC, you've literally got the Biden administration on record saying consolidation is bad. We don't want, big mergers, right? So despite the recent advocate, announcement and such, but, they're clearly saying no. And I was actually just part of a transaction, which is going through the state regulatory system, COPA, Certificate of Public Advantage, as a way to get sort of a get out of jail free card. They don't have to, they do still, submit paperwork and the application to the HSR, but they essentially get a pass, right? So, there are some different environmental factors for organizations who are looking to scale in that way. But, Brett, and you can sort of comment on some of the other components of Tom's question.
Yeah, but I think, hurdles be damned. We're going to continue to see consolidation. We've gone through a lull, which to me is really the result of the pandemic and the massive financial struggles that most health systems are in now, right? They had kind of government funding to float them for a while. This year is horrible for most health systems, and next year is not going to probably be a lot better, both because of the workforce challenges that we're seeing and the fact that, not everything is back to the way it was, so to speak. We're probably going to continue to see that lull for some period of time, but eventually the move to consolidation has to come back. Tom and I were talking before we got started. If you look at the top 5 insurers in the country make up something like 70 some odd% market share. The top 5 pharma players make up something like almost 80% market share. And then you go down the list, and every different sector of healthcare looks like that, but you get to providers, and the top 5 maybe make up about 5%. Right? Because we traditionally, the conventional wisdom around consolidation is that it's like a game of Risk, right? Or like the maps, the moving maps that you see of the plague crawling across Europe, right? And that you have to first build regional density and then move out from that central point of strength. I think what Atrium and Advocate, the deal that finally closed just last Friday, what that may teach us, and the jury's out, right? We'll see. What it may teach us, or what it may portend, is a trend toward more of these massive extra regional partnerships. You know, we saw Ascension and Providence start to go down the aisle a couple of years ago. It didn't work out. We saw Sanford in South Dakota with Intermountain in Utah, right? They went down the aisle for political reasons. That sort of fell apart at the 23rd hour. Atrium and Advocate is sort of the first really good example of this in modern times. And I think we're going to see more of it. You know, more of these big players coming together. Now, you can ask the questions around how are they really going to extract value out of that? And you know, a lot of those are really good questions. You know, certainly there's got to be operational benefits to it, but when you start thinking about clinical benefits, whether it's innovation or, you know, enhanced clinical delivery, service lines, the like, you know, the jury's out on that. I think that the digital age in healthcare has opened some doors that perhaps were not there pre-pandemic, that maybe they're now, that can enhance the ability of, say, an Atrium and Advocate or somebody similar to partner in new ways on the clinical front. But, you know, that's, I guess, all of that is to the long way of getting to, in the next 2 to 3 years, you know, we'll see continued momentum toward consolidation. I think, you know, maybe a little bit of a lull. I think, you know, in some ways we're coming out of that lull, but it's not going to be a huge spike. 10 years from now, you know, in the far future, I think we're going to see much bigger consolidation in the provider landscape, because simply stated, these organizations can't survive with today's sort of paradigm and their relative, you know, position in the pecking order.
So let me follow up just a little bit and make it more
Sure.
local for us. This is, yeah, there's big pharma, and yes, we do have a fairly big insurance company in town. But there's, you know, we're sort of the birthplace of the med tech area, and they have consolidated some, Medtronic, Covidien being one good example, but not nearly as much as pharma has. And one of the things I'm struck by is they've become global as well. And so they're selling into countries, right? And having negotiations with a country buyer. When they get domestic and do it in the US, they have all these different buyers, put the GPOs layered on top of that. And I just wonder, Brett or Jodi, as you go from increased consolidation over whether it's a 3-year or 10-year time frame, do the other suppliers, whether it be drugs or infrastructure or devices, do they have to start getting bigger too if they want to have fair negotiations?
So it's an interesting question. I was actually talking with somebody recently, and while we were not talking about healthcare, we were talking about wine, and they were talking about how they, Canada specifically, and how you can't just import to Canada without, you have to go through the government. You're negotiating with the government. You're importing to the government, right? And versus the United States, where you're working with individual states that have regulations, and then you have to find the distributor, right? So an analogy in the sense that, you know, it's much easier to work with these countries, right? They're buying big volume. And, you know, what's fascinating is, of course, if you look at the spend, right, the US being, you know, the most, you know, I shouldn't say that, but one of the most expensive, right? And so, you know, we're actually having to pay for that additional cost of doing business, you know, if you think about the research and development and, you know, all the rest, right? The sales that go along with that sort of a distribution, sales and marketing model, it's completely different. So, you know, while, you know, consolidation, you know, could certainly help them with profits and, you know, revenue and the like, I mean, they're seeing it, they're marking it up in different ways, right, to make up the difference. So
I
hospitals,
guess,
on the other hand, it's a, it's a different economic model, right? So, sorry, Brett, go ahead.
I guess maybe the way I would answer that question is to say, I hope not. Because if all of this race to scale is about negotiating power, then we're racing to somewhere that I hope we're not going, which is that somehow healthcare is going to make up an even bigger proportion of our GDP, right? And prices are just going to go up, up, up. Like, we should be playing a zero-sum game or maybe a negative-sum game to some degree. So I mean, it's a reasonable question. I don't know the answer to the question necessarily, but I kind of hope not, right? I hope it doesn't become so much a price negotiation strategy as it becomes, more about delivering kind of the right healthcare model for the community.
Got it. That's our first 30 minutes. I love being able to bridge to the unrecorded part that we're going to do now with the wine business analogy. I just that was great. That's my take home.
Yeah, it might apply to whiskey as well. So just one last thing as we close out the recording part of it. I mean, I know we're going to talk about labor shortages and things like that, or labor strife. One thing that it is interesting to me is that it clearly is not just local. I mean, if you look at, like, the UK is going to strike on their nurses, and their ambulance services are going to strike. And I think, Brett, your last point about the disruptions in the market, just the uncertainty, I would just put it under just getting amped up in a way that we've not seen, honestly, in society for a while. I think that's just driving so much of it, when you come right down to it. So we are going to go off the record, Jessica, if you can do the honors. It's great to see a bunch of folks still here. This will be a fun conversation.